You are tuning in to Living Mentally Well with Kevin Hines. Follow us as we interview some of the greatest, most influential minds and public figures in the fields of suicide prevention, entertainment, activism, mental and behavioral health. We welcome you to listen, learn, watch, and enjoy. This is Living Mentally Well with Kevin Hines and our guest, the one, the only, the great Lacy Kendrick Burk. Lacy, can you tell me how cool your husband Greg is?
Oh my gosh, he's one of the most amazing people I've ever met.
Most amazing.
It's on video.
Ever met.
Yep.
Period.
Mm-hmm.
Gregory, if you're watching, this one's for you. Okay, now we're serious. All right. Lacy, I want to know if you can tell me if the mental health resources where you live are easily accessible or not, in your opinion.
In my opinion, I think that there are a lot of services offered. So I live in Phoenix currently. Where I live, I think that there are a lot of services offered. As far as accessibility, I mean, we have some public transportation. For me, obviously, I work in the mental health field. So it's really easy for me to understand where to go, what to look for with mental health services. I have a car, it's easy for me to get there. For most people in my community, and I think this is true of a lot of communities, transportation is a huge issue, but even more than that, understanding where to go, where to even start to look, how do I pay for it, is my insurance going to cover this, do I have insurance, where do we get, I think that there's just so many barriers to accessing appropriate mental health services that many people end up not.
That's right. So the barriers to care are affecting people's lives all over this country and all over the globe, with a potential lack of accessibility to these programs that some people, maybe a great deal of people, just don't know where they are, how to get them, how to reach them, and how to help themselves heal. Lacy, can you tell me what mental health means to you?
What mental health means to me?
It's the first thing that comes to mind.
When I think of mental health, I think about wellness. For me, mental health has a lot of factors, and it can be positive, negative, and I think about all of the things that people in communities say about mental health. I do a lot of advocacy for mental health, especially young people experiencing mental health challenges, and a lot of what comes to mind with them is the things that they hear from other people. But to have positive mental health, to understand that that's a part of your health, that everybody has mental health. It's just another aspect of what you have to think about within yourself. And then I think about well-being. I think about what you have to do to maintain that mental health. You have to understand your mental health, first of all. You've got to be able to understand what helps it, what harms it, where to go to get just some support when you can't manage it by yourself, or you're having difficulty. And I think the thing that really makes a difference in mental health is having other people to talk to who experience the same things. For me, I'm super lucky. My husband is a major mental health advocate, and so I get to talk to him, get to talk to people like you about experiences that I've had that I know you've shared. And to me, that's probably the most healing and positive thing about mental health.
Wonderful. Her husband is Greg DiCharry, a passionate advocate, a pioneer, and a champion of mental health all over this great nation. Lacy, I asked this of someone earlier today. What are some changes that could be made to mass media and how they cover mental health and behavioral health topics on this planet?
One of the things that mass media can do a lot more of, I think, is even being open about it. One, accurately portraying what mental health and mental illness looks like in media and movies. There are some really great movies out there who do it well, and talk about the realities of what it's like. And not only does that help to reduce stigma, that helps to educate the community at large about what is needed to help support these people. And it helps reduce the fear, which helps reduce the isolation, which is a huge part of that doesn't help people with mental health, is that isolation. And so, just talking about it is really a huge step. Talking about it accurately is important. And then when celebrities come forth and they talk about what they're dealing with. I had the chance to meet Demi Lovato. We shared a stage at the mental health Awareness Day a few years ago, and the fact that she has 12 million young people that follow her on Twitter, and she talks about mental health, and she talks about the realities of it, and she says, I have these struggles too, so that people can relate to them. I think it helps to really lessen that dark curtain that a lot of us feel around the stigma of having mental health challenges.
So in a sense, people like that with that kind of reach can help normalize something that so many deem as abnormal.
Absolutely.
But I always say there's no such thing as normal. I didn't invent that saying. It's been around for a while.
Mm-hmm.
Lacey, can you tell me a little bit about the work you're doing in foster care and mental health around that arena?
Sure, yeah. I think in foster care, probably one of the biggest challenges that young people face is that of providers. Providers are not aware that a lot of behaviors that young people exhibit in foster care are a result of being a normal teenager and are a result of having experienced trauma and traumatic experiences. Going into care itself is traumatic, and then not having the proper support and being able to identify that as trauma and then have the proper treatment. And so what happens is that young people get medicated to treat those symptoms, and it's not treating the underlying cause. And so especially for foster youth, what I try to do is I do a lot of speaking engagements, but I talk to young people and I mentor young people individually around thinking about mental health. We don't really talk about that. We don't talk about recovery in foster care, and recovery in the sense of substances, in the sense of being well, in the sense of mental health recovery. And so I talk with young people about that and what to think about. And based on my experiences, I aged out of foster care. I didn't have appropriate services. I had a lot of trauma that went untreated. I chose alcohol as a way to treat that for several years. Lost a full ride scholarship because of that. Almost didn't graduate. Had suicidal ideation because of isolation. Just a lot of experiences that I know a lot of other young people from care go through. And so I try to shed light on that. I try to talk about it because there's not a lot of people that talk about it, and try to educate them on what trauma is, that a lot of the behaviors that they're having are probably because of trauma, and that figuring out your mental health and knowing about your mental health is super important.
I think it's crucial, and we're here at the Indiana Systems of Care Conference. You spoke today. Can you tell us a little bit about your presentation today and the impact that it may have had?
Sure. So what I talked
And it definitely had. Go ahead.
Definitely had.
Go ahead.
Maybe had. I talked about leadership today, and when I talk about leadership, I talk about youth voice and young people who have these lived experiences within systems, within mental health challenges, maybe foster care, maybe substance use, but how they can turn either what they are experiencing now or what they have experienced in the past into a leadership skill. And how do they utilize that to help themselves in their own life, help their peers in their community, and help direct systems change at a state, local, or national level. And so in order to do that, young people need to recognize that they're leaders, and they all are. Some of them just don't know it yet. So we help them to recognize that, talk about characteristics, leadership skills that they might have, and how to develop those.
So taking the power within and expressing it to do good in the world is kind of what you're all about. Would you say that's accurate?
I'd say so, yeah.
I think so. Lacey, when you were in schools, let's say high school, college, was the schools you were in actively working on teaching students about mental health back then? And I think I know the answer, but Lacey, if they weren't active in teaching you about mental health, let me ask you this: would you have benefited from that kind of education back, let's say, starting in high school, even grade school?
Absolutely. If we can make mental health a part of normal conversation, then everybody will benefit. Not just people with extreme mental health challenges, but everybody. I mean, the world would be a much more well place. So looking back, had I had appropriate trauma treatment, had I been able to understand what had happened to me in terms that made sense to me, had I been able to speak with other young people who had experienced the same thing, had I even been able to listen to conversations from people who were experiencing it, I would have been able to recognize that within myself. I would have been able to get the appropriate kind of help a lot sooner. Probably wouldn't have taken 6 years and lost a scholarship to graduate undergrad, things like that. And so it was a really long road to understand my mental health journey and what I needed to be well in that. And had we had those conversations sooner, absolutely, I would have benefited.
So if you listen to Lacy here, you're talking about putting that kind of education in schools from a young age, I think. I think even grade school would benefit if told in the right manner, with the right tone, with the right message. We could help youth and kids, students of all ages, understand from a very young age what mental health is, why it matters, what suicide is, how it happens, and how to really prevent it from early on. I think if we focus our efforts in the nation around that, you're going to turn around generations, and they're going to grow up knowing about it. So when they do run into a severe or moderate, medium, mild, whatever kind of mental health challenge, or their friends do, they comprehend it, they empathize immediately as opposed to ostracizing themselves or others and becoming uninclusive. I think that it's time this country makes a shift to do just that, so that we can ensure the future generations are knowing what to do, who to turn to, and how to get hope so they can heal. I think it's very important.
Yeah, absolutely. And the other thing with that is I think bullying has a huge impact on the wellness of students, and also can lead to suicide attempts. And it's not just the bullying of people who outwardly express mental health challenges, but the young people who are bullies themselves are likely going through some kind of mental health challenge. And so it's a win-win. If you can start having normal conversations about mental health, everybody can understand and everybody can relate to that. And I think it makes the whole world a more well place.
That's right. We talked about this today in my presentation. Words can damage and hurt, and words can help and heal. And if we are going to let a generation or generations in grade school even hurt others around them because they're hurt, that's unacceptable. And bullying goes around all over the world. I remember back when I was in grade school, that my tormentor would have someone grab me from behind, and then he would punch me in the gut where no one could see the bruises, and so he wouldn't get in trouble. And the reality was that young man, that grade schooler at the time, was being physically abused in his own home. And so I didn't find that out until much later, but that was a catalyst into what he did to other people. He was abused, and he became the abuser. And this kind of activity and hazing and teasing, it's one thing to make a joke and jest. It's a whole other entire thing to target someone to harass, and it's not acceptable. And we can change that paradigm if we teach kids at a very young age about empathy and how to rise above and become empathetic toward all walks of life. Dr. Thomas Joyner, in his book, he talked about a factor of empathy that people either have or they don't. And he could measure someone's empathetic tone, and if they didn't have it, they weren't going to just get it eventually. But if we started so young, at such a young age, we're talking about people that would grow up with empathy for others, and I think that's crucial. Lacy, one last question, so I don't keep you here forever. One last question. Lacy, can you tell me a couple of things you do every day for your mental health that sustain you?
For my mental health, I think knowing what I've accomplished is important for me. Being able to get sleep is huge. I've learned that over the years. Pulled many all-nighters to figure that out. As a person who experienced trauma, I manage that every day, and so sleep is one of those things that doesn't come easy. I have to really work at being able to get sleep. And so some of those things, journaling to get thoughts out, having a bedtime routine, having the environment correct for sleep is really important. And then, nutrition, eating, I can tell a difference whenever I'm eating healthy foods versus when I'm eating processed foods. My mood is different. How I feel about myself and in my body is very different. And then, if I ever do come across a struggle or a challenge, being able to reach out and talk to other people. For some people that might be easy, but for me it took a lot of years to develop that skill, to actually understand when I need to reach out and when I need to talk to people about, maybe it's even that, gosh, today is really hard, or I'm struggling with XYZ, but actually reaching out and connecting with somebody to say that, I think, is really crucial for me.
So reach out, connect with your interpersonal relationships, exercise, sleep well. It's not all going to come overnight. It's going to take time, but you have the time and you can do it. Lacy, thank you so much for talking to us. Really
Kevin.
Appreciate it. I'm going to give you a hug because without. Living Mentally Well with Kevin Hines, Lacy Kendrick Burk, everyone.
Thanks.
This has been Living Mentally Well with Kevin Hines, brought to you by 17th and Montgomery Productions. Thank you for tuning in. Subscribe below and let us know the thoughts you have in the comment section. Everyone has a story. We want to hear yours because you matter.